You're up, Abby.
The symptoms for me started as slight tremors. From there, they got worse. I convulse, tense up. My torso will twist, a loss of breathing that looks like an exorcism.
I hate to just lift your legs up from the... It's such a controversial condition. It tends to be a bit hidden.
So just have a walk up here.
I have no control over it. All the muscles in my legs will seize up. I can't move, I'm just paralysed. And if that happens when I'm standing, down I go.
It's not a very well known and recognised condition out there in the community. I think it is much more common than we realise, but it's still a rare condition.
Good to see you again. Can you tell me a bit about it?
I was hospitalised for 7 weeks and slowly I was unable to walk.
Savecha, Kimberly and Karen have all been diagnosed with conversion disorder.
So 100 years ago, everyone was talking about conversion disorder. It was big news, and it was big news because in the First World War there was an epidemic of it. What conversion disorder is a set of neurological symptoms that could be very different between different patients, but when you look into their brains, you can't find any damage that would explain it. The brain looks normal, the nerves work normally.
It's a physical manifestation of a psychological condition.
It's not something which is fabricated or put on by the patient, but it's something which is automatically occurring as an avoidance of some kind of underlying stress or anxiety and automatically being converted into a very real and often very functionally impairing horrible symptom.
Symptoms that may present in conversion disorder patients are paralysis, seizures, blindness or hearing impairment and loss of speech. The severity varies, but for most sufferers, it's a crippling condition.
Nobody knew what to do with me. We had this diagnosis of conversion disorder. The psychiatrist I was seeing at the time wanted to put me in the psych ward. It made no sense to me at all. I wasn't hugely depressed. I wasn't suicidal. My legs just weren't working. So I ended up with Dr. Kanan.
Hi Karen. Hello. How are you? We've been running this clinic here at Austin Health for about 2 years now. We've probably seen 100 patients. We get lots of severe cases. Most of them are profoundly disabled. We've had patients who've been having perhaps 100 fits a day. Lots of patients who are in wheelchairs, patients who are bedbound, unable to get out of bed at all. And the number of referrals we're getting is growing all the time.
Dr. Kanan is a leading psychiatrist treating conversion disorder. In the UK, he ran one of the world's only specialist clinics before coming to Australia to treat a growing number of cases here.
The key thing about conversion disorder, what makes it different from other psychiatric problems, is the symptoms are all physical. So finding out where the symptoms come from is a real challenge. And that's what makes it difficult, I think, for everyone to understand.
The research on conversion disorder tells us it's generally caused by trauma and errors in the way emotional information is processed by the brain. In some parts of the world, it's estimated that there are 1 in 20 people living with conversion disorder, most prevalent in young women.
Do you want a cup of tea?
Yes.
Basically, in your brain, in the subconscious area, the emotion is meant to go to emotion. In my instance, the emotion goes to physical. So instead of me having an emotional experience like anger or crying or whatnot, I won't do any of that. I won't feel the sadness. It'll come out 2 weeks later as an attack. It's one of the worst feelings of your life.
When Kimberly's attacking, it's difficult to watch. It's hard when you see someone fitting that you care about and you feel powerless. You can't stop it.
Kimberly is 24. She suffered from conversion disorder for the past 6 years. It's still unclear what triggered it for her initially.
So the worst point of my attacks, I was having them 3 or 4 times a day. Most of them go between the 20-minute, half-hour mark. One of my worst ones was probably 5 hours. And then they moved on again to as if basically I was a stroke victim where exactly half my body was paralysed. So you could feel everything just drop. And that's basically where I'm at now. I'm still going through the half stage of losing half my body. So the treatment that I was recommended was a neuropsychologist. I go there once every 3 weeks and basically just spend the hour going through techniques to retrain the brain. So basically what I think is completely normal, I've had to rearrange and start my whole life again and just try and make sure that my brain connects to what it's meant to connect to.
Treatments are as complex as the condition itself, and much like the symptoms, are different for each patient. Most would usually come through emergency, be referred to a neurologist, and finally a psychiatrist. For Keren, it's a combination of consultation with Dr. Kanan and physiotherapy.
Just do it.
That's better.
Yeah!
Keren's life is greatly restricted. She's unable to work, she can't walk independently. A really severe thing is when she falls out of nowhere, and that's how the condition started.
2 years ago, Keren was a healthy young woman, a successful teacher and basketballer. She had a series of random falls. Although there was no physical damage, the trauma converted in her mind to a chronic fear of falling. As a result, she feels she can't walk without this frame.
I've been trying to get Keren to walk, say, 10 metres away from the rail, but Keren feels that's overwhelming, so I've brought the chair closer to 5 metres. She still felt that was too far. I've brought it now to 1 metre, and she still feels it's too far and feels that she will fall despite me being here.
I know what I can do and what I can't do on any given day, and today it's not happening. It's not happening.
What do you feel in your legs right now?
They're like tense. All the muscles are clenched tight. And that's why I feel like I can't walk to that chair, even though it's 1 metre away from me.
There's no question that Keren's legs, nerves, arms, muscles all work perfectly normally. That's one of the things that we establish. We do a bunch of tests. It's only when she thinks about it that she has the problems.
All righty, let's come out here. Sometimes it just takes time before they can come to terms with the fact that it's not physical, and that needs to be done in a very sensitive way. So maybe a better term for fake physio is sensitive physio. Okay, off you go.
You're not going to let me hold on to you?
No.
So physio helps by building confidence, which is a big thing with conversion disorder, I find. The more confident I am with walking, the better I can walk. So it's been baby steps building up that confidence.
Do you want to get better?
Yes. Who would want to live like this?
Conversion disorder is curable, and there are ongoing studies to develop new treatments. Dr. Andrew Court works with children and adolescents suffering from the condition.
The children and adolescents who present with conversion disorder present in a similar physical way as do adults. We see the difficult, hardcore end of patients who are functionally impaired, and we see about 20 patients here at the Royal Children's Hospital a year.
I first started displaying symptoms of conversion disorder and was diagnosed when I was 15. How it started was I had an allergic reaction whilst coming back from an unaccompanied trip from Canada to Australia, and the plane had to emergency land because I had anaphylaxis to teriyaki chicken.
Anaphylaxis is a deadly allergic reaction that cuts off the respiratory system. Savecha almost lost her life, aged just 15. The trauma from that experience converted in her brain. She developed an extreme phobia of food, ongoing seizures, and loss of feeling in her arms and legs. After a 2-year recovery under Dr. Court's care, Savecha was cured. She's now 23.
Most conversion disorders do not have relapses in the future. Most, when you recover, you get over.
Conversion disorder makes very clear the power the mind has over the body, but because of the stigma attached to this illness, it's difficult for patients to get the right help.
There's quite often a sense from a society's point of view that if you have a condition which is not a medical condition but has a psychological basis, somehow you're faking it or putting it on or imagining it. Clearly it would be really wonderful to try and change that stigma.
I've chosen to talk about it publicly because I understand that now it's more common than ever, and I just want people to understand that it's okay to talk about it and not suffer as I did.
I just want people to know that it is a real condition and that it does exist. In terms of me fully recovering from conversion disorder, I think, yes, I eventually will be cured of this and I won't have to deal with it.
The likelihood of Keren fully recovering is unknown, but the fact that she's receiving really good care and she's shown such a lot of insight into the condition and the causes of it, I feel really optimistic.
It's hard thinking about how life used to be. I don't know, sometimes I wonder if I'm going to get back to where I want to be, but I try not to think about it because it doesn't help.